Also across river, Lagos and Ogun states are states said to be mostly affected by Mpox. What is Nigeria doing about it? What should you know about Mpox? We have joining us on the program this morning the Director General of the Nigeria Center for Disease Control, Dr. Jide Idris. You can see a breakdown of the Mpox outbreak in Africa. But let's speak with Dr. Jide Idris this morning as we walk through this, well, worrying dimension of Mpox. You're welcome to the Morning Brief, Dr. Idris.
Good morning to you. Good morning, viewers.
Well, Dr. Idris, Nigerians are still trying to grapple with cholera, how to, stay safe and all of that. Then all of a sudden, Mpox comes right round the corner and they're wondering what exactly is going on. You have spoken about this, you've granted a press. You said that the country is ramping up efforts to contain this. Speak to us about those efforts, then we'll break it down, Dr. Idris.
Well, I know any country should be in a position to be able to respond, prepare and respond appropriately to any disease outbreak. That is it. Can you hear me?
Yes, please, Dr. Idris. Go ahead.
Hello, can you hear me?
Yes, Dr. Idris, I can hear you loud and clear. Please go ahead.
Yeah, I said any country should be in a position to be prepared for any emergencies, especially those related to diseases. That's what preparedness and response is all about. And that's just the mandate of the National Center for Disease Control. Throughout the year, we track diseases of public health interest, and especially those of them that are endemic in the environment. Just like you rightly said, we've been battling with a lot of outbreaks in the past couple of months. Cholera, meningitis, Lassa fever, and now we have Mpox. And basically, the system is slightly simple. We track occurrence of these diseases from different parts of the country. We also know how these diseases are contracted, how they are transmitted, what causes them. So specifically from Mpox, it is one of those diseases called zoonotic diseases. And let me, by the way, most of the diseases we come across here, diseases of animals, are zoonotic diseases. That's it. Diseases of animals, primarily animals that get in contact with human beings and infect human beings. And that's what Mpox is all about. Unfortunately, too, Mpox can be transmitted from human to human. And that's why, again, that it's very essential that if we know the transmission of diseases, how these diseases occur, we can easily control them. For Mpox, this is an issue of contact. If anybody gets in contact with an infected animal or any materials that have been in contact with the animal used to treat these animals, or in contact with an infected human being, he or she is likely to get this disease. And that's why it's very essential that issue of contact should be addressed fully. At least if you come in contact with somebody, you know somebody who is ill, who has this disease, avoid contact. If you are caring for that person, ensure that you are gowned properly, you are protected, wearing protective clothing, gloves, and nose covers, etc. It's basically just to prevent you from getting contact with this disease. And especially how are these? Like I said, these are diseases of animals. Basically, these are diseases of rodents, squirrels, and monkeys. These are not fully confirmed. These are suspected. And so if you have all these animals, if you see an animal similar to this that are ill, avoid them. If you are cooking these animals, again, ensure that they're properly cooked and we are cooking properly disposed of carefully. And when these people who contact the disease, it presents in a very typical way. Start with fever, body chills, muscle aches. But typically you have this rash that resembles smallpox rash. The rash starts from the face, it spreads down to all of the body, to the palms and soles of the body. When this rash starts with like pustules, they start exuding some fluid and becomes pus. And this is about the time they get infected. And this is about the time, again, people should actually move away, do not get in contact with these patients. So if you have any patient, any friends, any relations who present with things like this, please advise such people to go straight to seek health care. That way they can easily be treated. Secondly, when this disease occurs now, we've at NCDC, we've been in contact with activated what we call Emergency Operations Center for Mpox. We've appointed an incident manager. We've started moving around and we've talked to people at the Port Health Services. Basically, now those are people who handle people who come into this country. People coming now are mandated to fill these declaration forms where several questions are asked as to, related to this disease, especially from those countries where these diseases have been have occurred, especially from the East Africa, Central Africa, and so on. Even from Europe, a couple of cases have also been detected in Europe. So, people coming in are subjected to these forms. They're supposed to complete these forms. From these forms, those people who you suspect might have disease are taken aside and asked specific questions and tested. So far in this country right now, we have 39 confirmed cases, and luckily for us, no deaths. We've intensified what we call our surveillance systems, that's tracking diseases, especially in those areas where we feel Mpox have been detected. States like River State, Cross River State, Abia State, Lagos State, Taraba State, and I think Bayelsa. Those are key areas where some of these cases have been detected. Secondly, we met with all the healthcare commissioners in all the states just to enlighten them again to ensure that they too establish their own emergency preparedness systems, which they've done. We are sending them materials to guide them into how to make diagnosis, how to track, and public awareness systems all over. They go to different parts of the states and local governments again, enlightening the public on what Mpox is all about, how Mpox is contracted, how it is spread, how it presents, and what people should do.
All right, Doctor.
Basically,
just to add to some of the things, a few questions more to add. You mentioned a couple of states. And I couldn't help but notice that there are states within the coastal area. Maybe you can explain to us, maybe you can help us. I was saying that, Doctor, that in listening to you, I can see that a couple of the states that you mentioned are coastal states. Maybe you'll be able to explain to us exactly why that is. Just hold on, sir. In terms of geographic mapping, and also the people that have been confirmed, 39 of them. Maybe give us some level of demographic, I should say, distribution.
Well, I know that we've got cases from Lagos. The highest case is from Bayelsa. We have 5 cases. We have in Cross River. We have in River State. I think we have in Enugu. Those are the cases I can remember. And I know that on the whole, we have about 19 states. Those are the ones that have relatively high number of cases. I also do know that in different parts, studies have been conducted, especially with the last outbreak in 2022. Many of these cases were, last time we have Bayelsa, Cross River, Ogun State, Lagos, Ebonyi State. I think there's Rivers, and there is Enugu. I don't have the full details here on me right now, but I can send them around. But these are cases where in 2022, some of these cases were detected much earlier. And that's why the emphasis has been there.
Okay. So I was talking about demographic distribution, age, and all of that.
Yeah, unfortunately, many of these cases are found in the younger age groups. That's 0 to 10. But again, you have cases again cutting across all age groups. From about 10 to 40, 50. Yeah, there are many cases like that. About 10 to 20% of cases are in younger age groups, 0 to 10.
Okay, so let's talk about you've been talking about response, and one of the major places that I would like you to speak to, and what the agency is doing in terms of collaboration with these areas. Now, especially that local government now have financial autonomy, so we expect that they should do more. In terms of the primary healthcare facilities, how much of facilities and measure is being put in place at that level to ensure that those of them that are within the lower cadre around the economy are catered for as quickly as possible. We're grateful and happy that there are no fatalities recorded at this moment.
That's the reason why we met because a few days ago with the commissioners of health in all the states. One, to give them materials on how to do this. Two, to ensure that they themselves now set up the emergency preparedness in the various local government areas and states. They are going to go back again to meet with their DSNOs and the public health practitioners in the local government areas. They're going to work with the communities, and especially with respect to public awareness. What we've told them is that once they have any suspected case, they know precisely where they send these people to, where samples can be taken, and these samples again have been they need to be taken to specific laboratories for quick, prompt diagnosis. Unfortunately, we don't have those many laboratories that have those capabilities, and that's why we're trying to expand increase the numbers like we have. Right now, we have key laboratories at Port Harcourt, Enugu, Lagos, even at HCG in the Osun State. But from any state, once they have samples, they know precisely how to transfer these samples to those laboratories for quick diagnosis. But more importantly is the public awareness for the local government areas, which the states are handling. The states have that sole responsibility. They have the wherewithal. They have the structure in place to get these things across to the various people. More importantly is the public awareness that is essential. Expect people who have these symptoms like we highlighted, they should seek quick medical advice.
All right. So in a nutshell, I just want to break it down for Nigerians. Is this something that we should be worried about? And I wanted to put it on a scale. There's cholera, there's COVID-19, maybe that's extreme, but people also want to find a way to properly view this. So where would you place that, and how should we approach this, Dr. Idris?
Let me put this away. There was a technical working group that was established. They assess the risk level of Mpox and they place a high risk. So people should be very, very cautious at high risk. So whether with cholera, yes, we have cholera that kills more people, that they've killed so far more than Mpox. But again, we were lucky. And it says that the strain we have here is what they call the clade 2, that is very mild. But we are not resting because we don't know when clade 1 will come in. We're not hoping that it will come in, but we need to be prepared. And that's why we're enlightening all the laboratories now. That's why the border areas are being sensitized, so that we can increase our vigilance. And once we're empowering all the laboratories we mentioned there with reagents so that they can quickly do a quick turnaround in diagnosis. So we can quickly get this, because clade 1 is more serious. We don't want to have that in this country right now.
Right, and that's a concern that a lot of people have shared. I was just reading Professor Tomori also sharing that concern, saying he's worried about clade 1 being imported into the country. And this is not to drown people in all of the medical or epidemiology terminologies. This is a major concern. And that's why I asked that, how do we place this in terms of, severeness, or, how serious it can be. But I'd like you to speak to us also on how this messaging is getting to the grassroots. Now, doing research about this recent spread, it's actually been attributed to Nigeria as far back as 2017, and it's some sort of blame being placed at the table of Nigerians or otherwise, that, well, this is where we've pinpointed it to. That's on the one hand. On the other hand is the name itself. A lot of people knew it as monkeypox before. It was changed to Mpox because of the possibility of it being misconstrued, as targeting a particular ethnicity, group of people or otherwise. So it was changed from monkeypox to Mpox. But the point is, there's a lot of attention on Africa, and where you zoom in closer on Nigeria. So how are you handling all of that heat, if I can call it that as well?
Well, there is this is also falls under what we call a One Health, they call it One Health approach. Since the disease of animals basically that finds way to human beings, there's a there's the concerted effort now under the One Health platform, which means that the ministries of health, the Ministry of Environment and Agriculture must work together. And whatever we do, the policies will be the same, actions will be the same. In the Ministry of Agriculture, they themselves are tracking some of these diseases in animals under their purview. The issue of environmental factors now, all this deforestation. You see, some of these animals have their special habitats. Once we disrupt them, that's when this disease starts spreading. That's when they start coming to humans, and that's why it's incumbent on us, the three ministries or agencies of government, to work together to address this. Whereas both at the level of health sector, the agricultural sector, especially with respect to animals, and the environment. Let's forget your second question now. Can you come again?
Yes, just quickly, I was asking how you're handling all of that heat. Nigeria being responsible for the latest spread.
Yeah, that's what I'm saying. It's a collective effort now under the One Health agenda.
Okay, and then the grassroots part, ensuring that this gets to the grassroots, the people who really need this message.
And that's why, again, it's also called enhanced surveillance. There's what they call community surveillance, which our health workers go into the various communities, work with the community leaders, and just like they are trying to track other diseases, they include Mpox in it. Right. It's just like enlightening them, telling those people again, and people go around again. And once they see cases like this, similar cases, they report. They know what to report. They know who to report to. And this is a send back to us through the states and to NCDC.
All right,
it's the same thing we use for most other diseases. Yeah.
Right. You can land on that point as we wind down. Okay, I thought you were going to make a point, but we have to thank you so much, Dr. Jide Idris. A lot of people who knew you as commissioner would obviously be looking up to what you will do at the helms of NCDC. We wish you the very best, Dr. Idris. Thank you for your time.
Yeah, thank you very much.